our slides show that you can file online or in person, and that is incorrect. You do have to file online through the civil service, excuse me, Civil Service Division of HCM. We have attached that information on our website to show you where to file and to make sure you get your complaint filed appropriately. I want to reiterate once again, there are some shortened timelines, and that is the 5 business days that you have to file. We've gone from calendar days to business days. So that is like a Monday through Friday. So were you to get your notice of an adverse action on a Wednesday, then you would even have the weekend would not count towards your 5 days. So that would give you some extra time. But please make sure you get those filed timely. Otherwise, we're going to be sitting on the sidelines. So the other thing that I want to remind you about is that right now, the Civil Service Division does not have a way to automatically notify OPEA if one of our members are filing a complaint. So if you're filing a complaint and you are a member of OPEA, please give us a call so we can get the copy of that, so we can find the best way to be of assistance with whatever issue is going on, so we can make sure you get the services that you're needed to get you through that process. Again, 5 business days, that's really an important aspect, because again, we're all used to that calendar day, but it's 5 business days. So again, that's something that we need to make sure of. The other thing I want to talk a little bit about is that right now we have a lot of folks who use their state email addresses. I would like to encourage you to use your personal email address and let OPEA know that address, because one of the things that happens if you are on a suspension without pay, or God forbid that you get terminated, you have no way of getting that information to us, or we don't have any way to access that information from you. So it's really important that we have like a personal cell phone number, personal phone number, and your personal email address. I know a lot of folks are like, well, that I use my state for everything. Well, that may be well and good for now, but something happens, and then we're all sitting here with no way to communicate. So please make sure you get that information to us. We do have all of the information on our website. It's listed on the 2022 personnel updates on the opea.org website. So please make sure that you go to that and keep a watch on changes, because we'll be updating that. These are emergency rules, and those will be in place until at some point we have the permanent rules implemented, and that's going to be after the legislative session starts, probably maybe toward the end of the legislative session, because the legislature has to vote on this and approve all the permanent rules. So again, we're working with the emergency rules. Those could change. I don't see any really drastic changes coming, but again, stay tuned, because we're going to be updating that information as we go through the permanent rules. We continue to work with the human capital management staff, the House and Senate leadership and their staff, as well as the governor's office, to look at these possible changes to rules, so to have the best possible outcome we can have for our members. And again, I'm getting calls from folks who are pretty excited about the fact that they were always in an unclassified position and could not file a complaint. And now 95% of the state employees do have access to file a complaint on adverse actions, which of course include the written reprimand, suspension without pay, demotions, terminations, and punitive transfers. And I want to touch just a little bit on punitive transfers, because I've had some questions, which punitive transfer really is not going to be a punitive transfer if an agency closes an office or realigns an office and moves your work site. That's not considered a punitive transfer. I know it may feel that way, and but that is not the case. So again, just want to talk a little bit about, if you have any questions, any concerns, give us a call here at OPEA, 405-524-6764, or email us at, you can email me at dixiej@opea.org, and we will really try to get that answered for you as quick as we possibly can. So if you have any questions about that, let us know. Again, go to the website, check out the legislative or the personnel updates for 2022. We're starting the legislative session, so I'm kind of in that legislative mode right now. But again, please remember we're in the emergency rules. I think it's gone okay, but we're only in January 13th. So I feel like we probably will have a few little snags along the way, but we can work through those, working together with everybody. So that's kind of what I have today. We'll be coming back on as rules change or information needs to be disseminated. So as I say, stay tuned for coming attractions. Thanks, guys.
Thank you, Dixie. I appreciate it. A couple of questions came in asking about how do they get that information to you, their personal stuff. Chanson has put those links out there as well. We do have one individual who's asked to ask a question. That's Alexis. Alexis, if you want to unmute and ask your question of Dixie before we move forward. Going once, going twice. Alexis, if you want to unmute. If not, feel free to type it into chat and
or give us a call. Yeah, we're here.
Again, Chanson, there's a couple of questions out there looking to help you out that way as well. So again, more work that OPEA is doing on your behalf to understand some of these changes, these rules, and really pay attention as we go through as far as the legislative session that's going on out there. So real quickly, my name is John Green. I work with Association Member Benefits Advisors. I live a little bit north of Houston, although I started my schooling in Oklahoma in Bethany, but my wife is a school teacher and my 3 kids, we follow the Baylor Bears. So it's been a good year against Oklahoma teams, but I wasn't going to mention that, Dixie. My
There's
role,
always next year.
There's always next year. My role is working with active state employees and active educators to help them understand what their retirement looks like. And that's part of these conversations we have today, a little bit about what we do and how we take care of you from the AMBA side, but how OPEA impacts you. They're out there looking to preserve your pension, to make sure those benefits that you're working for now, whether you're retired or you're active, are going to be there in your retirement years, working towards those benefit raises, those health increases, the health benefits, things like that, keeping you connected to your fellow coworkers, whether you're active or retired, and then partnering up with AMBA to bring in those benefits and discounts and fun things that are outside of what the state provides for you as well. We are an organization that works with 70 associations, very similar to OPEA and OREA there in Oklahoma, that work with public servants. David Morris, as I mentioned, is our leader in Oklahoma, lives in Edmond. He and his team are there to design to kind of review your benefits with you, help you understand what the state provides for you, and then understand what the state doesn't provide for you and where those gaps are out there. One of the main reasons or the main things that OPEA members tell us that they like being related with AMBA and having their benefits is it fills those gaps that aren't covered by their state benefits. They're portable. If you leave state employment, you don't have to worry about losing those benefits. You can use them wherever you want to and take them with you. The 2 main reasons that a lot of OPEA members say that they like their benefits with AMBA is the fact that they can extend them to family members that may have aged out of their benefits, or they can extend them to parents that were never eligible for their benefits. And it can prevent you from possibly having to take off long periods of unpaid time for taking care of a loved one because you've got the proper benefits on them as well. So we want to talk about what our goals are today. I want to first, before we do that, find out a little bit about who's on our call today. So I'm going to launch a quick survey, a quick poll, and it'll help us kind of direct our conversations today. So if you'll tell us a little bit about you, whether you're active or retired, we'd greatly appreciate that. If you'll just drop that in there, because we can move through some of the stuff pretty rapidly. And Looks like we're mostly active employees in the state, and that's fine. That'll help us roll through here. We do have some retirees that have joined us. So just a few more seconds out there, and we'll close the poll, publish the results, because it looks like we're overwhelmingly active state employees out here. So that's great. We appreciate that. We'll end the poll, share those results out there. And like I said, we're 95 plus active. We do have some retirees that have joined us as well. So we're going to spend just a tiny bit talking about some of the new laws, the Social Security and Medicare changes. We're going to introduce our special guest with us, and she's going to share with us some health choice enhancements and wellness opportunities out there that you can maximize your benefits you receive. And we're going to talk about some of the major gaps that could be out there. And then we're going to jump in and talk about financial things that you can act on immediately for yourself and for your parents that can save you a whole lot of hassle going forward out there. So real quickly, we want to talk about a new law that just took place back at the first of the year. It's related to surprise medical bills, or you're going to hear the term balanced billing. It's when you have a procedure or you receive some type of emergency care, and all of a sudden you think, well, I've got coverage through my plan, and then you see a bill that you didn't expect out there because it's a provider that was not part of the network, or the provider charged more than what the network allowed, something like that, and you get certain billing out there for that. This was part of a 2020 COVID bill, crammed a lot of stuff in there. It really addresses how out-of-network providers have to give you a certain amount of notice before a procedure, so that way you can either shop around or you know what's coming in there. It doesn't change anything related to co-payments, co-insurance clauses, or deductibles, but it just requires any type of disputes to be taken to a third party so that you're not surprised there. It impacts air ambulance providers, and we're going to talk a little bit about that in the future. We're going to find out how more that works, but it doesn't impact ground ambulance providers, and those can still be a sticky bill. If you have to take a ground ambulance transportation, you could still get hit with some surprise bills out there. So just know that that's coming and is already in place. Cassie told me that Health Choice and others have been preparing for this, and they're ready to roll if that does become an issue. Real quickly, for our retirees on there, Social Security cost of living increases did go up first of the year. Averages about $92, can max up to close to $200. Medicare went up the same, went up as well. So now you're having to pay $170 a month on top of other expenses out there. And just a real quick look for your retirees or those who are close to retirement, cost of living increases have not been going up near as fast as Medicare changes have been going up out there. So that's just some things to think about that way. We have a Medicare webinar coming up that we'll talk about those things, those changes significantly as well. For those that have the Medicare Part D, which is the drug plan, the deductibles went up and the donut hole widened up as well. So we'll talk about that in the future as well. Medicare did take some significant cuts going into 2022. They've been in place for years. They just keep moving and inching along. It could impact you when you retire. On top of all the increases in deductibles and premiums, they've been cutting hospital services. Really what that means for you, if you're a retiree on Medicare or your parents are on Medicare, it could mean, bottom line, that certain providers are no longer receiving reimbursements that meet their costs, and they choose to not participate in the Medicare program. So that can put you or your parents at a lurch. Just know that that's out there. Those changes are taking place. If you did have a life-changing event and you're a retiree last year, because your Medicare premiums are indexed or based upon your income, you'll need to file a form SSA 44. If you had a marriage or divorce, spouse pass away, some other type of life event that could have changed your income, you can change your Medicare premium. So just know that that's available out there. If you've got questions, David and his team understand fully all the Medicare changes out there and can help you navigate that process as well. But really, I want to talk a little bit more in depth about understanding your plans. Now, the plans at the state, you had to lock in last year. You're already in them. Understand your co-pays, how they work with your deductibles and your co-insurance, and what your out-of-pocket maximums can be. Because there are certain things, and Cassie, our special guest, is going to help you understand and navigate health choice and understand what those things are for you, because we want you to be a better healthcare consumer in 2022. Understanding your coverage is so important because there are certain things that are built in there that could be gaps. It could be things you weren't expecting from an expense standpoint, but also there could be some perks and incentives that could be out there for you that you want to take care of that help you to get involved with your preventative care and things that can help you avoid more healthcare problems in the future there. I encourage you strongly to ask about pricing transparency. And I'll give you a quick example that my wife had. You know, when those first cold fronts blow through and the temperature drops and you get a sinus infection because of the plant allergens or tree pollen, things like that. Well, that first sinus infection, back in November, my wife calls her doctor. I need to get a doctor visit. She's a teacher. She can't get in until after hours, things like that. They said, we won't see you until you do a teledoc visit. She says, okay, line me up for a teledoc visit. The teledoc visit took about 15 minutes. And they told her basically, you got to take a COVID test. We're not going to come. We're not going to let you in. We're not going to see you probably. We're not going to give you any prescription because by the time you get to see us, your sinus infection will be gone. They charged her $200 for that. If she would have asked up front, what's the cost of a teledoc visit? She probably wouldn't have done that and would have gone somewhere else and shopped around for services. So I encourage you, in being a better healthcare consumer, understand what's out there for you, shop around for those services, and ask what the price is up front. Just because you may have a deductible or you may have a copay doesn't mean that they can't charge for other things that are not part of those services. So now I want to bring in our special guest today. She is Cassie Lewis, Director of Operations for the Employee Group Insurance Division. She's going to talk about health choice because that's what most of our OPEA members are on, is health choice. So Cassie, welcome today. Share with us some ways that our members and those folks on the call today can be a better consumer of their health choice plan in 2022.
Thank you, John, and good afternoon to everyone, and thank you for having me today. Health Choice is changing customer service by continually improving our technology and the services that are available to our members. One of our current enhancements is our smartphone benefits app. This benefits app is available to all of our members who are currently enrolled in medical coverage. It does not apply to members that only have dental, but as long as you have medical, you can enroll, and as long as you are not actively enrolled in Medicare. So this basically applies to all of our actively working members that do have medical and/or dental coverage with their medical. There are 3 easy accesses to be able to download this app. You just simply create an account, and then you have immediate access to start chatting with our care guide. All of this interaction is via a text, so you don't have to pick up the phone, you don't have to call anybody, you just start texting and it is available 24/7. Some of the most frequently used features that I want to talk about briefly is our newest feature, which is the claims and explanation of benefits option. You just simply click on this link and it will direct you to our Health Choice Connect claims system. What is unique about this is it is now a single sign-on, and you no longer have to have multiple, passwords to be able to see your explanation benefits or your claims. There are some important things that you need to remember about this. Due to HIPAA, if you are over the age of 18 or you are a spouse, you will not be able to see those people's claims. They will need to download their own app and be able to access the information for them. The next thing that I want to talk briefly about is the talk with a doctor option. You went too far. Go back. Okay, so talk on the option to the doctor is our telemedicine doctor, which I'll talk a little bit more about in a moment. But these services are easy to access. You just click on this feature and it takes you directly to the phone number to connect with Swiftmd. We also have the new option of the medical and cards and pharmacy cards link. This will allow you to have your pharmacy card or your medical card right there with your phone. You don't have to search through your purse. You don't have to go through your wallet. If you're standing at the pharmacy, you need your ID card. You simply click here and it's available to you. And last option, I talked a little bit about the care guides. Some of the things that the care guides can do for Health Choice members is connect you to our zero cost services. They can help you with any benefit question that you have. They can schedule a doctor's appointment for you with our zero services, and they can help you review your claims. So that's a lot that people don't even know that is available, and all they simply do is send a text, and there it's available within 60 seconds of response. Next slide, please. Another member enhancement that we have worked on, and I'm super excited about this one. The one thing that COVID did bring is the ability to have telemedicine. I know John told you a little bit of a scary story there, but I'm happy to tell you the difference between telehealth and telemedicine. Telehealth is available to any of your local network or out-of-network doctors, and you simply choose this yourself. If your doctor that you're seeing does virtual visits, we are happy to cover that. Now, all the way in through COVID, these were allowed at zero cost to our members. But as of January 1st, for any telehealth visit, that is subject to your normal copays. Just keep in mind that this was previously excluded, but it is something that we are happy to be able to continue, and the services are still available. Some of the calls that we've been getting just here in the past week or so, members think that Health Choice no longer is covering telehealth, but we are. We will continue to cover it, and it is, available at a simple copay if you're on the Health Choice High or Basic plan, and then it is available for a charge up to the allowable on the Hdhp, the high deductible health plan. Now, telemedicine is a service that we were talking about just a moment ago on our app. This is available 24/7. It's for your minor services that you need, colds, earaches, flu, you just don't feel good, you can't go in. This service is available. All you have to do is call Swiftmd. It's available for all of our Health Choice High, Basic, and Hdhp members. But keep in mind that the services for the High and the Basic are free of charge. It's unlimited year-round, 24/7. But on the Hdhp plan, you must meet your deductible first, and it is a $45 service fee. After you pay the $45 or you've met your deductible, these services are also free to you. Next slide, please. Swiftmd is our telemedicine doctor. It's easy to enroll. All you simply do is you do need to visit swiftmd.com. You need to enter the passcode of Health Choice OK 20, and then it will allow you to start accessing these services by, unlimited visits. So make sure that you do register before you try to use the service, and each member needs to register that is over the age of 18. And then it is available to you 24/7. Next slide, please. The Health Choice Wellness is something that we are very excited about. This is the opportunity that we begin to offer our new STEP program. The STEP program is available to any of our members that do download through the app, and it is available for, smartphones and the Android phones. And if you are looking to start tracking your steps or be interactively involved, we do that daily, weekly, and monthly, and it does provide you with information on how you're doing on your walking. We just introduced this back in October. We're excited to be able to have this option, and it is interactive with a smart watch. So if you have a watch, it will start clicking away at how many steps you've made, and then you can see if you have met your goal. It does have set goals available to you to help participate in this new program, which we call the STEP program. Next slide, please. Wellness Spotlight. This is fairly new to the Health Choice standalone website, and it is available to provide you with up-to-date key highlights on what is happening in the healthcare industry. We do update this quarterly, and it provides you with up-to-date popular wellness services that coincide with your current Health Choice benefits. Keep in mind that if you would like to see some of the archived articles that are available, you can simply click on that, and then it will be available for you to download and print in a printable version to take with you anywhere you may need to go. Next slide, please. The Health Choice Wellness Case Management and Care Management Program is something that we've actually had for several years, but a lot of people are not familiar with it. There is a difference in a case management and a care management doctor. So case management is a group of nurses that are actually located right here within the Employees Group Insurance Division. What these nurses do is they actually provide you with one-on-one assistance if you need to go out of our network for services that aren't available. Say that you need some help with some home health care services. Maybe you need to get some durable medical equipment certified, or maybe you need some assistance with mental health or substance use disorder. These case management nurses are here and available for any Health Choice member. A care management program is something that is available for those people that actually need a little bit more personalized assistance, and they are maybe high risk and have chronic disease. What we have discovered is that as the nurses proactively reach out to these members, sometimes they aren't sure about the nurses calling, but they are there. It is voluntary, and they are available to help you coordinate care with your primary care physician, coordinate care with any type of a facility. They help you understand the risks that have been involved. So it's available for anybody, say that you're going through cancer treatment, maybe you have diabetes and you need assistance, or perhaps maybe you are scheduled for a transplant. You're not alone with Health Choice. We are available to you. Again, it's voluntary and it's free of charge for you. Next slide, please. As part of Health Choice's commitment to have better health for our members, for many years now, we have been offering the tobacco cessation programs and products. We encourage all of our members to try to quit tobacco. This does not apply to vaping. It only applies to tobacco products, and it applies to anybody that's available within your household. We do partner with 1-800-QUIT-NOW to where this is available to all Oklahomans. Health Choice members actually get additional services that are available to them, such as free coaching calls and or free cessation products. If you would like to utilize your Health Choice benefits, we actually do have cessation medications that are available twice a year. Some of the popular brands such as Chantix is available at zero charge to our members. All you need is a simple prescription from your doctor to access these medications. Keep in mind that the 1-800-QUIT-NOW program is available 24/7 and is available to assist you or your dependents. Next slide, please. In closing, I want to talk a little bit about just a few reminders. One of our plans that people are starting to join is our Health Choice High Deductible Health Plan, also known as the Hdhp plan. Why this is popular is because it has the lowest premiums that are available. It actually allows you to have a health savings account that combines with the high deductible health plan. A family on this plan is considered 2 or more, to where the other plans that we offer, the Health Choice High and the Basic, is 3 or more. So that is an added benefit. And then after you actually meet your deductible, then you will then act like the Health Choice High plan, which means that you'll have copays that will apply, co-insurance that will apply at 20% for network services. And then once you meet these services, then it's paid at 100% by Health Choice. So some of the things that people don't know about the health savings account is that you can keep that health savings account with the Hdhp, and you do not lose those benefits each year. Next slide, please. The Health Choice Select program, I hope by now that everybody is kind of familiar with this plan. It's been offered for about 6 years through Health Choice, and it is available for all of our members, whether you're high, whether you're basic, or whether you're Hdhp. What is unique about this program is it is designed to reduce the cost because you have selected to utilize our select facilities. We bundle the rate just to have one bundled program part, and then that is what we pay directly with the facility. For Health Choice High and Basic members, any service that you access through this network is no cost to you. There is one thing that I like to point out, because some people don't understand that in order for the whole service to be free of charge, you have to keep in mind that any service that you have before, leading up to your surgery and or MRI or CAT scan, and anything that's after, that is subject to regular benefits. But the day of your actual service or surgery, all of those charges are paid for at 100% by Health Choice. Now, for our high deductible health plan members, they still can access the Health Choice Select program, but keep in mind that it is subject to their annual deductible. But after that deductible is met, they too can enjoy these services at zero cost. The one thing that I like to remind everybody, that even though you are on the Health Choice Select or Hdhp, you still get an added benefit if you do use these services before your calendar year deductible, because you don't get multiple billings. You only receive one, and it's one bundled rate, and therefore your out-of-pocket costs are much cheaper on the Health Choice Select program. Keep in mind, this is available all across Oklahoma. You just need to find one of the providers that's in your area, or you might have to travel a little bit further, but it is well worth investigating, and your care guide can help do this for you. So if you're interested and you need some help, you just simply chat in the care guide, tell them that you need to have a surgery and you want to access the Select program. They will help guide you there, and they will even help make your appointment. Next slide, please. We have lots of resources here available for our Health Choice members. We never want you not to be able to access anybody. On the healthchoiceok.com website, we have the handbooks available. You're able to find the Select network that I was just talking about. You're also able to locate any of our network providers, and you connect directly with Health Choice Connect. Now, if you are somebody that is thinking about retiring, or you have an issue that hasn't been able to be resolved, my team is available for you. We are the EGID member services team. We will have you, assist you in any way that we can, and we're available Monday through Friday, 8 to 4:30. The Health Choice Customer Care team is available for you to help you with any claims assistance that you may need, or if you need some help with some authorizations. So with that, I want to say thank you for taking your time, and I'm available for any questions if there are.
And Cassie, there are some questions that are in the chat feature.
Okay.
In relation to, the password again, or the activation code, things like that as well. So I encourage you, drop those in chat. Cassie will be following up with those as we go through the conversation today. But Cassie, thank you so much for being on the call today. Great information on how they can be better consumers of the benefits the state provides to them. So
You're welcome. It's my pleasure.
Let you hop on and keep chatting away. So if you've got questions, keep those coming. Cassie will fire up those answers on there as well. So when we look at plans at AMBA, David and his team, when they look at it, whether you're in Medicare, Health Choice, whatever that coverage is, depending upon your age, there are 4 key areas that are, I would identify them as gaps or missings out there, even as good a coverage as you have as the state employee. Most of them are related to any type of home care, health care facility, long-term care type coverage. Those expenses related to a cancer diagnosis, a heart attack, or a stroke after the procedure's done. A lot of those are related to transportation, to comfort items, maybe home retrofits, things like that, equipment, things that may not be covered that way. We talked a little bit about some of the ambulance transportation, the emergency transportation, those bugaboos that are out there, and then things related to final expenses after someone passes away. So those are some gaps that, even as good as Health Choice is and Health Select is and Medicare is a plan, there are some gaps that you may need to talk with David and his team about. But let's focus on our change a little bit now on the last few minutes of our conversation regarding healthy actions you can take for yourself, for your parents, going into this new year, that can get you on track in relationship to spending, insurance, planning an organization, and how to protect your nest egg. And there's 3 big items when it comes to spending that I want to show you some trends that are out there and then help you with take advantage of some of your benefits that you have as a member of OPEA related to housing, transportation, and food. And when you talk about house prices right now, depending on where you are in your stage in life, we talk a lot to retirees and they talk about downsizing and looking at your house. Is it still fitting what your needs are? The cost of housing is extremely high right now. You may be able to receive some value out of your house there. You're going to hear this term house hacking this year. House hacking is finding ways to make money with your house. It could be in terms of taking on a roommate. It could be in terms of using it for Airbnb purposes. If you live on some land or have a farm, I was just out looking at Airbnbs for farms. They're renting $500 a night to come experience what a life on a farm is like, stuff like that. If you've got vehicles and you've got a used vehicle that you don't use, that you're not using at all, the pricing now for used vehicles is astronomical. You may be able to sell that and put some money back into your pocket that way. Food is another major expense. I would encourage you to look at the Passport program through OPEA. Check it out on their website, or David and his team can hook you up with that. It can help you with meal prep, dining discounts, restaurant discounts, things like that. That can save you money, ways to put that money back into your pocket. When it comes to insurance, auto, home, and life insurance, check your deductibles out. I know oftentimes up in Oklahoma, you may have a deductible on your home that is small. And if you raise it up just a little bit, you can save some significant money out there. There may be coverage out there that charges you or gives you a bigger deductible for wind-related events like a tornado or hail. Check your policy to make sure that's out there on that. From the car side, if you're not driving as much, if you're working at home and not driving to and from work, you may want to call your insurance agent and say, hey, please re-rate me with a lower mileage rate out there. Look for affinity discounts for state employees, things of that nature. There could be discounts for you. Specialty coverage. Some companies will put on specialty coverage because you had pets or you did something before that you don't do now, or you don't have pets now. You can get that coverage off and save you some money that way. With your homeowner's insurance, if you've done major renovations, put a new roof on, new electrical, AC units, things like that, you can find some pretty good discounts out there. And then it's time to look at your life insurance. Make sure you have the right coverage that you need, whether you've got coverage through the state, whether you need to own your own coverage. There are policies out there that provide a wide variety of benefits, and David and his team can help you understand what your options are at the state, as well as what your options are outside the state, because you don't want to leave state employment if you're with the state and not be able to take that life insurance with you if you need it for your family as well. All right, I want to talk real briefly about planning and organizing. And this is simply because this is my New Year's resolution to myself, is to make sure that you have a complete Icod folder. And I call this an Icod folder in case of death or disaster. And so I want to take a real quick poll and ask the next poll, if I can find it out here real quick. If I can get it another poll. Well, I'm not going to do that poll. I couldn't access it. I apologize for that. I want to talk about this Icod folder. This folder is a way that you can organize your documents designed for you or for your family. I'm doing this with my mother this year, where you would put in there all these major important documents, and in case something happened to you or your parents, or in our case, I live about 70 miles from the coast, the Gulf Coast. In the case we have to evacuate, I can pull this folder and I can go, and it's got all my important papers in there. You want to put in 9 different types of categories of documents in there. Your life events, like your birth certificates, marriage licenses, divorce decrees. If you've adopted any children, put those in there as well. Your life insurance and retirement documents. And this is so crucial, especially for those of you who are active employees right now. And here's why. I want you to check your beneficiaries today. Do it before the end of the week. Make sure that you do this. David and I have done this too often to where we will go out and deliver a check to a beneficiary who happens to be the ex-spouse, simply because that employee never changed their beneficiaries on their life insurance. Or we could deliver a check to 2 of your 3 children because that third child that was a late in marriage child didn't get added on as a beneficiary. Those are not fun conversations that David and I like to have. So please check your beneficiaries. Put all of that information in your Icod folder. Make sure you have your pension documents in there. How to get a hold of the pension plan. What the pension plan pays after you pass away. Because for those of you who are on here who are retired and already receiving a pension, you may have different plans for your pension after you pass away that your surviving beneficiary doesn't know. So make sure you put those details in there as well. When it comes to your banking information, not only your accounts, but what are your passwords, log on information, all that kind of stuff, your credit cards. If you have safety deposit boxes, make sure you put where those keys are. My father-in-law's father passed away about 5 years ago and left him an envelope with about 10 keys, and that's it. He had to go all over South Houston finding out where those keys went. Make sure you put that information in there. All right, some other things to put in your Icod folder are your asset paperwork, your property, your land deeds, if there's any cemetery deeds, things like that, timeshare ownership, car stuff, anything related to outside savings, your IRAs, any old 401ks, things like that. Put all of that information in there, as well as your liabilities, your mortgage paperwork, any type of loans that you have out there as well. Real quickly about cemetery information. Maybe your parents, maybe you've done some pre-purchase of cemetery plots, things like that. Read an article recently to where for the first time in history, more people want to be cremated than buried. Your plans may have changed, or your parents may have changed their ideas on what they want to have done after they pass away. There are cemetery brokers, just like there are timeshare brokers, that will purchase or resell your cemetery plots. Maybe a way to get rid of those and put money back in your pockets if you don't plan on being buried anymore. Monthly expenses, make sure you've got a list of those monthly expenses out there, how to cut those off, make those payments if there is a medical issue that's out there as well. Social media accounts, what your passwords are for emails, cell phones, Netflix, all that kind of stuff. Contact details. This is so crucial, and this is why I'm doing this with my mother. Finding out who her doctors are, who her AMBA representative is, how to get a hold of David, that type of thing. Lawyers, any financial advisors or insurance agent, that kind of thing. I know who her minister is. We go to the same church, those type of contacts. And then any essential documents like wills, power of attorneys, things of that nature. And then what my mother wants to do for her to be done for her after she passes, what her wishes are. If you'll put those 9 things in focus, and I've got a link, and after this conversation, I'll give you my email address. David and I will send you those links, how to put your Icod folder together to make sure that you take care of your family, and how to set it up with your parents. That's so important there. And this is why I'd say this. This is a picture of 2 of the 3 most important ladies in my life, my daughter and my mother. My wife, of course, being number 1. This was at Christmas this last year. My mom turns 81 in May, and I've noticed that she's starting to repeat herself a little bit more, starting to ask questions, gets confused a little bit more than I expected her to at this age. And so I'm sitting down with her to build this folder so that if something happens to her, it's not as big of an issue. We know what she wants, we know how she wants it handled, and where her paperwork is. So I'm going to ask you to ask these questions of your parents, or if you're retired, share these with your kids. Where do you keep those documents? Create that Icod folder. Can I meet with your advisors? Who are your doctors, pharmacy, that kind of stuff? And then I want to sit down and ask her what her plans are for long-term care. If you've been on our calls before, on our long-term care webinars, I've told you about my father who passed away in October of 2020 after being in a nursing home for 2 years with dementia. You know, Mom, what happens if you can't bathe yourself? If you need someone to wipe your backside, those type of things. Do you want to stay at home? Do you want to move in with me or my brother? You know, do you want to go to a retirement community? Ask those questions of your parents now. Can save you and your brothers and sisters a lot of heartache in the future. Again, what their final care wishes are, and then what kind of treatment do you want in a medical crisis? If you'll ask those questions now, if you'll do that work for yourself now, your future self will thank you when those things come up, and you can deal with grief in the way that you want to. So if you're the parent, the elderly parent now, and you want to do this so that your kids don't have to worry about it, or if you're one of the children and you don't want to fight with your brothers and sisters, I encourage you to do this. I'll give you my email address at the end, and David will send you these links as well. This is a phenomenal document that AARP has put out. It talks about how to navigate that conversation with your parents or with yourself about becoming that advisor in your family's household. It gives you step-by-step how to navigate that road, the conversations you need to have, how to put your documents together and things as well. Again, we'll send you those links. Make sure that you're connected and protected and taken care of. And finally, when you're talking about getting your house in order, there are 5 major threats to your nest egg. Now, I'm not talking about your pension. Your pension is not part of your nest egg. I'm talking about that savings that you're putting away for retirement, savings that you may be putting away for some other issue there. There are 5 major nest egg scramblers, so to speak, that are out there. Taking care of your elderly parents, because we weren't prepared for that. The death of a spouse without life insurance, boomerang kids. And David doesn't understand this yet, but those kids could move back into your house. And, you know, that can put a pretty good crimp on your nest egg, a medical crisis, or being overly extended in the stock market. Now, as we know, the stock market has been going straight up over the past 10 plus years. If you were retiring back in 2009, the last time the stock market had a 40 to 50% crash, your retirement savings may not have been able to take that hit. You may not have been able to recoup that in time. So having a plan to protect those assets is vitally important now. Now, if I knew when the stock market was going to crash next, you wouldn't see me on this call. I'd be on a boat on a Caribbean island somewhere. This is just a kind of a look at those drops over the past decade or so, of whenever that's dropped more than 30% and taken over 2 years to recover. As you can see, it's been a long time since we've had one of those. And so you never know when that's going to happen. And so people starting to put their money into the savings account. They've got it in the stock market, which could be set for a bear market anytime soon, or you got money sitting around in a savings account. And we all know that the prices of everything, fuel, food, all that kind of stuff is going up and up and up. Inflation's going up. Savings rates are nothing. You can't put your money there and you're losing money that way. There is an alternative that OPEA endorses. It's a wealth management solution that allows you to participate in the stock market ups, but no stock market downs. The thing I like about it, it's got some long-term care benefits in there. So if you're thinking about, am I going to have to take care of mom and dad? You know, this may be something to look at with them to consider how they can take care of their long-term care needs, protect their money if they've got anything out there, or yourself in an old 401k or an IRA as well. So David and his team can help you with that. They'd be glad to help you understand that, because for those of us who are working now, chances are we're going to be living to 90 plus. We got a lot of years to live. We've got a lot of inflation to outrun. Those type of things is make sure that we're prepared for those years of extra living out there. So if there's any questions out there, I know Cassie's fingers are working furiously on her side of the house there. If you've got a question, there's 3 ways that you can get that done. You can email me. So if you want to email me and say, hey, John, send me those links to how to set up an Icod folder. Send me those links on how to have that financial conversation with my parents. There's my email address down there. David will get you those links right away. If you have questions about that wealth management solution, long-term care, cancer, any of the benefits that you have as an OPEA member, simply pick up your smartphone, hover over that QR code with your camera feature, open up your camera and hover over that. A little form will pop up. You can simply check a few boxes, put your name in there, and David and I will take care of you. We'll have this up here at the end in just a moment. Do want to remind you, take advantage of all of the discounts you have through OPEA through the Passport program. So many New Year's resolution things out there about getting healthy, about taking care of your taxes, all that kind of stuff, doing dental work, Smile Club, so many things out there. There's a ton of different things out there. Go check it out. It's a free benefit to you, saves you money, that's available to you out there as a member of OPEA. Coming up, we've got a whole bunch of webinars. We're going to be introducing our new dental and vision program to the very first time that goes live in February. Even if you already have dental through the state, there are some benefits you can take advantage of on top of that. We're going to talk about in February. It is the month of love. We're talking about heart and stroke and how that integrates with your medical plans. Coming up before spring break, we're going to talk about those emergency transportation issues and give you all the latest discounts. If you're planning a spring break trip, how that would work. And then in March, we're going to hit our 2 most popular conversations about long-term care. So take advantage of those, sign up for those, be on the lookout. Tony puts a great social media campaign out there, ways to register for these things, so get involved with that. So please tell your coworkers about this. We're going into legislative session. This is a great way to introduce them to OPEA and then have them become members. And the more members that we can take up to the Capitol and say, we've got X number of 1,000 members with OPEA, let's talk about benefits, let's talk about rules, let's talk about all these things. It really makes a difference. So let them know that you want to be involved in OPEA. So I'll stop recording here and